This medication is a combination of guaifenesin and dextromethorphan, and it's used to relieve coughs caused by the common cold, bronchitis, and other breathing illnesses. Guaifenesin helps to thin and loosen mucus in the airways, clearing congestion and making it easier to breathe. Dextromethorphan works as a cough suppressant by acting on a part of the brain to reduce the urge to cough. If you are considering using this medication, it's important to read the package instructions carefully to make sure it's the right product for you. Keep in mind that cough and cold products have not been shown to be safe or effective in children younger than 6 years, and some products are not recommended for use in children younger than 12 years. It's important to ask your doctor or pharmacist for more details about using this product safely. It's important to note that these products do not cure or shorten the length of the common cold and may cause serious side effects if not used properly. To decrease the risk for serious side effects, it's crucial to carefully follow all dosage directions and not use this product to make a child sleepy. It's also important to avoid giving other cough and cold medications that might contain the same or similar ingredients, and to ask the doctor or pharmacist about other ways to relieve cough and cold symptoms. When taking Dm-Gg-Potassium Citrate liquid, you can take it with or without food as directed by your doctor. If you are self-treating, make sure to follow all directions on the product package. It's important to drink plenty of fluids while taking this medication, as it will help to break up mucus and clear congestion. The dosage of this medication is based on your age, medical condition, and response to treatment. Do not increase your dose or take this drug more often than directed. If you are using the liquid form, be sure to carefully measure the dose using a special measuring device or spoon. For powder packets, empty the entire contents onto your tongue and swallow, and for the capsule form, swallow the capsule whole. It's important to note that improper use of this medication, such as increasing the dose or using it for a longer time than directed, may result in serious harm. If your cough returns, or if it is accompanied by a headache that doesn't go away, fever, severe sore throat, rash, or if it lasts or gets worse after 7 days, be sure to tell your doctor. These may be signs of a serious medical problem, and you should seek medical help right away if you think you may have a serious medical problem. If you experience dizziness, drowsiness, nausea, or vomiting while taking Dm-Gg-Potassium Citrate liquid, it's important to notify your doctor or pharmacist. However, many people using this medication do not experience serious side effects. While it is rare, a very serious allergic reaction to this drug can occur. Seek medical help immediately if you notice symptoms such as rash, itching or swelling of the face, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects, so if you notice any other effects, contact your doctor or pharmacist. As for the optimal timing and daily dosage of Dm-Gg-Potassium Citrate liquid, it's best to follow your doctor's instructions. They have determined that the benefit of this medication outweighs the risk of side effects, so it's important to take it as directed. If you have any concerns or questions about when or how to take this medication, be sure to consult your doctor. Before using Dm-Gg-Potassium Citrate liquid, it's important to inform your doctor if you have any allergies to guaifenesin or dextromethorphan, or if you have a history of breathing problems or liver issues. This medication may cause dizziness or drowsiness, especially when combined with alcohol or marijuana. It's advised to avoid driving or operating machinery until you know how this medication affects you. Additionally, the liquid form of this medication may contain sugar and alcohol, so it's important to consult with your doctor if you have diabetes or liver disease. If you have phenylketonuria, PKU, or need to restrict your intake of aspartame, it's important to discuss this with your doctor as well. Before undergoing surgery or if you are pregnant or breastfeeding, it's crucial to have a discussion with your healthcare provider about the use of this medication. It's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. Always keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Avoid taking certain MAO inhibitors with Dm-Gg-Potassium Citrate liquid, as it may cause a serious and possibly fatal drug interaction. Be sure to consult with your doctor before starting or stopping any medication. Additionally, check the labels of all your medications to ensure you are not taking more than one product containing guaifenesin or dextromethorphan. It's also worth mentioning that guaifenesin may interfere with certain lab tests, potentially causing false results. Be sure to inform all lab personnel and doctors that you are using this medication. As always, it's important to follow your doctor's guidance and recommendations when taking Dm-Gg-Potassium Citrate liquid. If someone has taken too much Dm-Gg-Potassium Citrate liquid and is experiencing severe symptoms like fainting or difficulty breathing, it's important to call 911 or a poison control center immediately. Symptoms of an overdose may include extreme drowsiness, blurred vision, confusion, hallucinations, slow or shallow breathing, and seizures. If you are in the US, you can call your local poison control center at 1-800-222-1222, and if you are in Canada, you can call a provincial poison control center. Remember, it's important to seek help right away if you suspect an overdose. If your doctor has prescribed Dm-Gg-Potassium Citrate liquid, it is important not to share this medication with others. Make sure to attend all medical and lab appointments as recommended by your doctor. This medication is used to make the urine less acidic and can help prevent certain kidney stones. It is usually taken with meals or at bedtime. The dosage is based on your medical condition and response to treatment. Be sure to take this medication exactly as prescribed by your doctor. If you happen to forget to take a dose of Dm-Gg-Potassium Citrate liquid, you can take it as soon as you remember. However, if it's almost time for your next dose, it's best to just skip the missed dose and take your next dose at the regular time. It's important not to take a double dose to make up for the missed one. When it comes to storing Dm-Gg-Potassium Citrate liquid, it's important to keep it at room temperature and away from light and moisture. Make sure not to store it in the bathroom and avoid freezing the liquid form. Different brands may have different storage requirements, so be sure to check the product package or ask your pharmacist for specific instructions. And as always, keep all medications out of the reach of children and pets. When it comes to disposing of this medication, it's important not to flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard the product when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on the best way to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.